151. What is the best method to prevent the spread of MRSA in a hospital setting? Answer: implement contact precautions and ensure proper hand hygiene. Explanation: MRSA spreads through direct contact, and contact precautions, combined with good hand hygiene, prevent its transmission. 152. A nurse is caring for a patient with a draining wound who has been placed in isolation. What should be done to reduce the risk of infection spread? Answer: use a sterile dressing and change it regularly. Explanation: using sterile dressings helps prevent additional pathogens from entering the wound and spreading. 153. What infection control practice is necessary when disposing of a contaminated dressing? Answer: place the dressing in a biohazard waste container. Explanation: contaminated dressings must be disposed of in a biohazard container to prevent the spread of infectious materials. 154. What should the nurse do before caring for a patient on isolation precautions? Answer: review the patient's specific isolation precautions and wear appropriate personal protective equipment, PPE. Explanation: understanding the required precautions and wearing the appropriate PPE minimizes the risk of transmission of infectious agents. 155. What is the best practice for preventing surgical site infections? Answer: administer prophylactic antibiotics prior to surgery and maintain sterile technique. Explanation: prophylactic antibiotics reduce the risk of infection, and sterile technique ensures no pathogens are introduced during the surgical procedure. 156. What is the primary action when cleaning a patient's room after they have been discharged with a suspected contagious disease? Answer: perform terminal cleaning using an EPA-approved disinfectant. Explanation: terminal cleaning is necessary to thoroughly disinfect all surfaces and prevent the spread of infectious agents. 157. When should a healthcare worker change gloves while providing patient care? Answer: after each patient contact, or if the gloves become soiled or torn. Explanation: changing gloves prevents the transfer of pathogens between patients and reduces the risk of cross-contamination. 158. A patient in isolation for a contagious infection requires an X-ray. What should the nurse do to prevent the spread of infection during transport? Answer: ensure the patient wears a mask and transport them with the appropriate isolation precautions. Explanation: wearing a mask and maintaining isolation precautions during transport reduces the risk of spreading the infection to others. 159. What is the first priority when caring for a patient with a suspected viral infection? Answer: implement appropriate isolation precautions based on the suspected virus. Explanation: isolation precautions are tailored to the mode of transmission of the virus and help prevent its spread to others. 160. A nurse is caring for a patient with a draining wound. What is the best method to prevent infection transmission? Answer: use gloves and a sterile dressing when handling the wound. Explanation: wearing gloves and using a sterile dressing prevents pathogens from being transferred to the wound and reduces the risk of infection transmission. 161. What should a nurse do when caring for a patient who requires a procedure while on contact precautions? Answer: ensure the patient is appropriately covered with a gown and gloves and limit movement outside the room. Explanation: maintaining the integrity of contact precautions ensures that infectious agents do not spread to other areas of the hospital. 162. A patient is diagnosed with tuberculosis. What infection control measure is essential for the nurse to implement? Answer: place the patient in a negative pressure room and use an N95 respirator. Explanation: tuberculosis is airborne, so a negative pressure room and an N95 respirator are necessary to contain the bacteria and prevent its spread. 163. What is the appropriate action if a nurse accidentally pricks themselves with a needle while caring for a patient with HIV? Answer: immediately wash the area with soap and water and report the incident to the healthcare provider. Explanation: promptly washing the affected area and reporting the incident helps prevent potential infection and ensures proper post-exposure care. 164. How should a nurse handle contaminated laundry from a patient on isolation precautions? Answer: place the laundry in a labeled, sealed bag and send it to the designated laundry area. Explanation: Contaminated laundry should be handled with care to prevent the spread of pathogens. It should be placed in a sealed bag to avoid airborne transmission. 165. A nurse is caring for a patient who has a urinary tract infection, UTI, and is receiving antibiotics. What is the priority infection control measure? Answer. Practice good hand hygiene and ensure the patient is using a clean catch method for urine samples. Explanation. Hand hygiene helps prevent cross-contamination, and using a clean catch method for urine samples reduces the risk of contamination during testing. 166. A patient in isolation has a wound with purulent drainage. What infection control measure should the nurse take? Answer. Use personal protective equipment, PPE, including gloves and a gown, during dressing changes. Explanation. Wearing appropriate PPE ensures that the nurse does not come into contact with infectious material and prevents the spread of infection. 167. What should a nurse do if they observe a visitor not wearing the required PPE while visiting a patient in isolation? Answer. Inform the visitor about the isolation precautions and provide the appropriate PPE. Explanation. Ensuring that visitors follow proper infection control protocols is essential in preventing the spread of infection. 168. What is the most important infection control action when caring for a patient with a draining wound and suspected MRSA? Answer. Implement contact precautions and ensure thorough hand hygiene. Explanation. MRSA is spread through direct contact, and contact precautions, combined with hand hygiene, are essential in preventing its spread. 169. Which of the following is the most effective way to prevent the transmission of infections in a hospital setting? Answer. Adhere to standard precautions for all patients, regardless of their diagnosis. Explanation. Standard precautions include hand hygiene, use of PPE, and proper disposal of waste, which are effective in preventing the spread of most infections. 170. When caring for a patient on droplet precautions, what personal protective equipment, PPE, should the nurse wear? Answer. A surgical mask, gloves, and a gown. Explanation. Droplet precautions require a surgical mask to prevent the spread of respiratory droplets, along with gloves and a gown to protect from contamination. 171. What should the nurse do when a patient with a respiratory infection is admitted to the hospital? Answer. Place the patient in a private room and implement droplet precautions. Explanation. Respiratory infections are transmitted through droplets, and isolating the patient with droplet precautions helps minimize the risk of transmission to others. 172. What infection control practice should be followed when preparing medications for a patient on contact precautions? Answer. Ensure the medications are prepared in the patient's room using dedicated equipment. Explanation. Using dedicated equipment and preparing medications in the patient's room ensures that no contamination occurs in other areas. 173. When should a nurse wear gloves when caring for a patient with an indwelling catheter? Answer. Wear gloves when performing any procedure that involves contact with the catheter or urinary drainage. Explanation. Wearing gloves protects the nurse from potential exposure to pathogens, particularly when handling devices like catheters that are in direct contact with the urinary tract. 174. How should a nurse clean a surface that has been contaminated with blood or body fluids from a patient in isolation? Answer. Clean the surface using an EPA-approved disinfectant. Explanation. An EPA-approved disinfectant is effective in killing pathogens, ensuring that surfaces are properly sanitized and preventing cross-contamination. 175. A patient diagnosed with a gastrointestinal infection is placed on contact precautions. What is the nurse's primary responsibility? Answer. Ensure that gloves and gowns are worn when entering the patient's room and when handling contaminated items. Explanation. Contact precautions prevent the spread of gastrointestinal pathogens, and proper use of PPE is essential for infection control. 176. What is the most important action to take when caring for a patient with a C. difficile infection? Answer. Wash hands with soap and water rather than using alcohol-based hand sanitizers. Explanation. C. difficile spores are not effectively removed by alcohol-based hand sanitizers, so thorough hand washing with soap and water is necessary to prevent the spread of infection. 177. What should a nurse do when a patient on contact precautions requires a procedure outside the isolation room? Answer: ensure the patient wears a gown and gloves during transport and that the procedure area is disinfected after the procedure. Explanation: wearing protective gear during transport prevents contamination, and cleaning the procedure area reduces the risk of spreading infection. 178. What is the best way to prevent the spread of influenza in a healthcare setting? Answer: ensure healthcare workers and visitors wear a surgical mask when in close proximity to the patient. Explanation: influenza is transmitted through respiratory droplets, and wearing a surgical mask reduces the risk of transmission. 179. What is the nurse's responsibility when caring for a patient with a known drug-resistant infection? Answer: follow strict contact precautions and ensure proper environmental cleaning. Explanation: drug-resistant infections require stringent infection control measures, including contact precautions and thorough cleaning of patient environments. 180. What is the appropriate infection control measure for a patient with a suspected viral hemorrhagic fever? Answer: implement standard and droplet precautions, as well as contact precautions. Explanation: viral hemorrhagic fever is transmitted through contact with bodily fluids and respiratory droplets, requiring multiple precautions to prevent transmission. 181. A nurse is assisting in the discharge of a patient with a contagious infection. What is the most important instruction for the patient? Answer: practice strict hand hygiene and continue isolation precautions at home. Explanation: continuing isolation precautions and proper hand hygiene are essential to prevent spreading the infection to others after discharge. 182. What is the primary infection control measure when caring for a patient with a surgical wound? Answer: use sterile technique when changing the dressing. Explanation: using sterile technique when changing a surgical dressing minimizes the risk of introducing pathogens into the wound and helps prevent infection. 183. When is it appropriate to use an alcohol-based hand sanitizer? Answer: when hands are not visibly soiled and a quick hand hygiene measure is needed. Explanation: alcohol-based hand sanitizers are effective at killing most pathogens when hands are not visibly soiled. 184. A nurse is caring for a patient with a draining wound who requires a dressing change. What is the most important infection control measure? Answer: perform hand hygiene and use sterile gloves. Explanation: hand hygiene and sterile gloves prevent the introduction of pathogens into the wound during dressing changes. 185. How should a nurse dispose of sharps used during patient care? Answer: place the sharps in a puncture-resistant biohazard container. Explanation: a puncture-resistant biohazard container safely contains sharps and prevents injury or the spread of infection. 186. What should a nurse do to maintain infection control when caring for a patient who is receiving intravenous fluids? Answer: ensure the foresight is properly covered with a sterile dressing and monitor for signs of infection. Explanation: a sterile dressing prevents contamination of the foresight, and monitoring for infection ensures early detection and intervention. 187. What is the primary goal of infection control in a healthcare setting? Answer: to prevent the spread of infectious agents to patients, staff, and visitors. Explanation: infection control aims to break the chain of infection to prevent the transmission of pathogens within the healthcare setting. 188. What should be done before performing a wound dressing change on a patient in isolation? Answer: review the patient's specific isolation precautions and gather the necessary sterile supplies. Explanation: preparing for the procedure with the appropriate precautions and sterile supplies ensures infection control during the dressing change. 189. What is the primary infection control measure when caring for a patient with a catheter-associated urinary tract infection, CAUTI? Answer: follow proper hand hygiene and use sterile technique when handling the catheter. Explanation: hand hygiene and sterile technique reduce the risk of introducing additional pathogens and prevent further infection. 190. When a nurse is caring for a patient on airborne precautions, which type of mask should be worn? Answer: an N95 respirator mask. Explanation: an N95 respirator mask filters airborne particles and is essential when caring for patients with airborne infections like tuberculosis. 191. What is the most important infection control practice when caring for a patient with an antibiotic-resistant infection? Answer: implement contact precautions and ensure diligent hand hygiene. Explanation: antibiotic-resistant infections require strict contact precautions to prevent transmission, and proper hand hygiene is crucial to avoid cross-contamination. 192. What should a nurse do if a patient's wound becomes infected after surgery? Answer: notify the healthcare provider and ensure that the wound is kept clean and covered with a sterile dressing. Explanation: early notification and proper wound care prevent further infection and allow for timely treatment. 193. What is the recommended way to prevent the spread of infection from an indwelling catheter? Answer: keep the catheter and surrounding area clean and dry and monitor for signs of infection. Explanation: proper care and monitoring of the catheter site prevent bacterial colonization and reduce the risk of infection. 194. What is the nurse's role in educating a patient with a contagious infection about infection control at home? Answer: instruct the patient to continue isolation precautions and practice proper hand hygiene. Explanation: educating the patient on isolation precautions and hand hygiene ensures that the patient prevents the spread of infection to others in the household. 195. How should a nurse care for a patient with a draining wound on contact precautions? Answer: use disposable gloves and a sterile dressing to cover the wound. Explanation: proper PPE, including gloves and a sterile dressing, prevents cross-contamination and protects both the patient and healthcare providers. 196. When caring for a patient in isolation, which of the following should a nurse prioritize? Answer: strict adherence to infection control precautions, including proper use of PPE. Explanation: adhering to infection control precautions, including the correct use of personal protective equipment, PPE, helps prevent the spread of infection. 197. A nurse is preparing to care for a patient with a ventilator-associated pneumonia, VAP. Which infection control measure is essential? Answer: perform hand hygiene and wear sterile gloves when handling the ventilator equipment. Explanation: proper hand hygiene and sterile technique reduce the risk of transmitting infection when handling ventilator equipment. 198. What action should a nurse take when a patient is admitted with a suspected influenza infection? Answer: place the patient on droplet precautions and provide a surgical mask if they need to leave their room. Explanation: influenza is transmitted through respiratory droplets, so droplet precautions, including a surgical mask, help prevent its spread. 199. What should be the nurse's first action when caring for a patient with a newly diagnosed infectious disease? Answer: review the patient's isolation precautions and implement them immediately. Explanation: isolation precautions are critical to preventing the spread of infectious diseases and should be implemented as soon as a diagnosis is made. 200. A nurse is caring for a patient on neutropenic precautions. What is the most important infection control measure? Answer: minimize exposure to sick individuals and maintain a clean environment. Explanation: neutropenic precautions are used to protect immunocompromised patients from infections, so reducing exposure to illness and maintaining a clean environment are essential.